Thank you very much for that. As we heard, I'm Rosemary Gillespie, and I'm Chief Executive of the Terence Higgins Trust, the UK's largest HIV and sexual health charity. On behalf of the researchers of the project, I'd like to thank the organisers for giving us the opportunity to present the findings from this small pilot study that we hope will contribute towards the development of a service for self-sampling in the UK to help improve HIV testing and drive down undiagnosed HIV. The project was funded in partnership with Public Health England and Terence Higgins Trust. The pilot explored testing history and risk behaviour of individuals requesting an HIV test through an online self-sampling service in England. Firstly, a little bit of background to the study. In the UK, there's nearly 100,000 people living with HIV, 1 in 5 unaware of their infection, of their status. And increasing HIV testing is a major component of HIV prevention by seeking to reduce the number of people who are undiagnosed. We know that HIV disproportionately affects men who have sex with men, and Black African heterosexual men and Black African heterosexual women. The self-sampling pilot involved people taking the test at home or wherever they chose, with results delivered later. This differs from self-testing, which involves taking the test with immediate results. The self-sampling pilot involved postal tests for HIV. The HIV tests were ordered online. It involved a 4th-generation dried blood spot HIV test. Samples were posted to the Public Health England laboratory in Manchester. Public Health England were our partners in the work. Negative results were delivered by text, and reactive results were delivered by a phone call from Terence Higgins Trust. It included recommendation that referral by us to HIV services took place, but people were given the option of self-referring, and 50% did opt to self-refer. We also sought advice to follow up because we wanted to confirm that people did have access to care, and we got this in 75% of the cases. The service was promoted through HIV prevention campaigns and social marketing, including sites such as Grindr, Gaydar, Facebook, Twitter, local campaigns in both communities. And the marketing campaign led people to an online service, and this was the only way that people could access it. Our approach proved effective for men who have sex with men, but it proved less effective for Black African communities, and this was part of the learning that we've gleaned from the study as well. We also noted that a higher proportion from the Black African community didn't return the test as well. So in order to seek to improve uptake in testing in the 2 target populations, the aims of the pilot were to describe the users of the HIV self-sampling service in order to evaluate the effectiveness of reaching target populations by investigating testing history and high-risk sexual behaviour. We ran the full pilot over 14 months between January 2013 and March 2014, delivering 18,000 test kits during that period. 10,500 kits were returned, and of those, 146 were reactive. We also collected extra data from 3,500 requests during a 16-day period from the 27th of February to the 14th of March this year. And during this time, clients ordering kits in this window provided additional information that provided the data for this small pilot. That included demographic information on ethnicity, gender, sexuality. It also included HIV testing information and the time since the last HIV test, if there'd been one, and sexual behaviour information, for example, the number of sexual partners, the number of unprotected sexual partners, and the frequency of sex under the influence of alcohol or drugs. As I've said, the two target groups were men who have sex with men who describe themselves as male and bisexual or gay, and Black African community who describe their ethnicity as Black African and who describe their sexuality as heterosexual. Largely because of how the services were marketed, of the clients ordering the self-sample kits, 137 described themselves as heterosexual, and of these, 88% of the heterosexual men were Black Africans, and 85% of the heterosexual women were Black Africans. The campaign proved to be very good at attracting men who have sex with men, and 94% of those accessing the service were men who have sex with men. And again, we think that's a product of how we marketed it. It was very successful marketing it amongst that community. It was less successful amongst the Black African community. Looking at testing history from the data we gathered during the short window, firstly looking at men who have sex with men, a third of MSMs reported never before taking a test, that's 33%, 41% testing over a year ago, and a quarter testing within the last year. This indicated that home sampling is popular with first-time testers, and it is reaching MSM not testing within the last 12 months, as per the current NICE guidelines in the UK. This group also reported that they found the service convenient to use. We're happy with it. Of the Black African heterosexual community, 40% of Black African heterosexuals had never tested before, 47 testing over a year ago, and only an eighth testing within the last year. There were no gender differences observed when men and women were analysed separately. The majority of the clients who used the service had multiple partners in the last 12 months. A large proportion reported sexual intercourse with 2 or more partners within the last year. 80% of men who had sex with men reported this. 65% of Black African men reported it, and 54% of Black African women, all reporting more than one partner within the last 12 months. In terms of sexual partners and testing history, men who had sex with men, 90% of MSMs who had tested within the last year had more than one partner. 80% of MSMs who tested over a year ago had more than one partner, and 75% of MSM who had never tested had more than one partner. With Black African heterosexual respondents, we only have the data for women. It was the opposite. Those with more sexual partners had not tested recently or had never tested. Although the numbers were low in this group, and again, that's one thing that we know we have to address. 60% of those who never tested had more than one partner. Just under 60% of those who tested a year ago had more than one partner. And for those who tested within the last year, 25% had more than one partner. So in conclusion, the self-sampling service did enable large numbers from target populations to test quickly and easily. Significant proportions of clients in the pilot had never tested before, and the Black African heterosexual women with more sexual partners had not tested recently, so the higher risk not accessing testing. Men who had sex with men with more sexual partners had tested more recently, and this group also told us that they found it convenient to use this service. So what we concluded was that the self-sampling service represents a novel, innovative, effective method of expanding HIV testing to individuals at high risk of infection who otherwise may not test. And to finish, we'd just like to thank the service users, the team at Terence Higgins Trust, and our partners in Public Health England. Thank you.
Thanks again.